Hello, it's Ken
And Jay,
from Levinson and Stefani Injury Lawyers. We wanted to give you a little bit of a peek of some of the internal processes we use to help our clients. Today, we're going to share with you some of the ways we keep track of our clients' medical treatment, the records, bills, and keeping it all together in the best organized way we can using technology. Uh, Jay, let's share our screen, or if you want to run the show here.
sure. So, like Ken said, one of the things we really try and take advantage of is technology at the firm. And we found it's a great way to securely keep track of everything and really stay organized and be a lot more efficient in how we help our clients. So, when it comes to medical records, the first thing that's always important is making sure we keep in touch with our clients and know every single medical provider, doctor, hospital, physical therapist that they're seeing to treat their injuries. Once we learn of each individual treater, we just go into our system here in Filevine under medical requests. We would add an item. And in this example, we have the very famous and well known test hospital. So we'd add who the provider is. We'd be requesting, in this scenario, both the bill and the record, who we're requesting the records through. And usually there's always these copy services that handle that. And also, what's very important is keeping track of when those records and bills are due. Now, in Illinois, typically they have up to 30 days to provide those. So what we do is we want to make sure that we're staying on top of it. So we just skip forward about 30 days. And what this does by entering this date in is it automatically triggers a reminder schedule for our team that if it hits December 18th and we haven't received the records or bills, we get a reminder to contact Record Copy Service and ask them where the bills and records are. Once we receive them, we would enter in the date that we receive them. That checks it off, clears that reminder schedule out. We would add the records and or the bills right into the system here. And then the person that enters that in would trigger this record review. And what that does is it sends it up to the chain where one of the attorneys actually goes in here, looks at the records and bills, and then goes on to the next step, which is going into our meds tab.
And by the way, let me interrupt you. You mentioned briefly security. How do we make sure that our clients' private medical information is confidential and secure?
So we make sure any service that we use, in this case Filevine, is exceeding standards in terms of encryption, in terms of passwords. We also make sure that everyone on our team uses a password manager. So it's randomized long passwords. We always make sure it's critically important. Good point, Ken. It's critically important that we make sure that all of our clients' information is secure and protected. So in this scenario, we would have had, for the hospital, we would have received the records and bills. The person going through them and reviewing them would check. We want to know who is the specific provider. So in this case, we'll just enter in here. It was Dr. Johnson. We want to check if the records that we received and the bills were related. Sometimes they could be unrelated. For example, if you are seeing your primary doctor, you might have seen your primary care physician for an injury related to the incident, but we might have received in that batch of records maybe a record for a visit where you went in for your annual exam, or maybe you just went in for a flu shot. We want to keep the records and bills separated, what's related to the case and what's unrelated to the case. We would then put in the amount for that visit, and we create one of these cards for each individual visit because we really want to stay organized and keep them split out. We also put in for that particular visit what our client's complaints were. If the client goes in and the doctor takes the history and says, patient complains of low back pain or shoulder pain or dizziness, we put that in here, the complaints. We also enter in what the physician actually coded as a diagnosis or diagnoses. And then if our client received any treatment or procedures in that visit, that could run anywhere from, getting a referral to go get an MRI, all the way up to surgery, physical therapy, whatnot. We also put the records and the bills just for that visit in the card. And we would put in any other notes that might be applicable, that might help us sort of keep track.
And let me jump in because using technology in the most effective way is so important because a lot of our clients have multiple treating physicians, therapists, surgeons. In fact, a client might go see a surgeon just to get a second opinion to make sure their fusion surgery, for instance, is really appropriate and necessary. And they might forget, oh, yeah, I had that visit. We have a virtual card keeping track. I really can't imagine a law firm not keeping everything organized in such a way because they're going to miss visits, they're going to miss important things that would really impact our client's case.
Absolutely. It gets overwhelming. We always like to tell our clients, their job through the process is to get better. See the doctors, do what the doctors are advising, get better. Our job is to take care of the rest. It's our job to worry about every other aspect. And while our clients are going to see the doctors, it's easy, exactly, Ken, it's easy to lose track of which doctors you saw, which dates, what the bills were. That's something that we do. In fact, we're able to run different reports based off of all of the treatment that our clients have received. Now, this obviously is a simple one where we just have the one example in there, but we can run a summary of all of the bills, which let's get in and look at an example there.
And while you're looking at the example, this helps us in a few ways. One, it makes sure that any settlement offer that we recommend is fair for our client. Two, when we're preparing for a deposition or statement for the other side's attorney, our clients can go through with us all the history of their medical treatment without missing a visit or a time frame because it's been maybe a year or two since they saw a specific medical treatment treater. And then lastly, if we are preparing for a trial, it allows us to be able to go through the client's history of medical treatment, medical bills, and recovery to present to our jury down the road in the most effective way.
Absolutely. And this is just an example of that bill summary. And this just pulls straight in off of the information that we put in Filevine. So each card, it has its own row. It shows who the provider was, the treatment dates, and the amount for that visit, and then provides a total. And like Ken said, this is a real quick, easy way that we can have everything organized to show the insurance adjuster, to show the defense attorney, to show a mediator, to show a jury. It's a great way to keep it organized to really quickly review it. Now, a couple of the other reports that we can run, which we're not going to go through examples right now, but for example, a medical chronology is it's similar to that last report, but on steroids. It has, for each provider, for each treatment date, it also shows all of the complaints, all of the diagnoses, and the treatment received, and any notes for every single visit. And we can include related, unrelated, and even if there are some prior records in that chronology. And it gives us a quick way to sort of go through and capture the entire course of treatment for our clients. And lastly, we can create a provider contact list. And basically what that does is it pulls up a list just of the provider with their address, a phone number, if there's an email address. Um, and that is nice because it lets us quickly organize in case we need to issue subpoenas. It also lets us check back in with our client, here, saying, hey, here's the list of all of the treaters that we are aware of that you have seen. Are we missing anyone? We try real hard to keep in touch with our clients to get that update. We know our clients try real hard to keep a list for us, but you'd rather be safe than sorry. And I know, Ken, like you always say, belts and suspenders. We want to double check and verify to make sure that we don't miss anything. And using this system is an easy way for us to cross check internally and with our clients.
And that raises another issue when we do resolve a case and settle a client's lawsuit. It's nice to be able to cross-reference to make sure our client's medical bills are paid. You hate to settle a case and 6 months or a year later, our client calls us up and say, "Hey, I got this bill for $2,500, and it wasn't paid out of the settlement because we didn't know." And we're not going to miss it, uh, like a lawyer maybe who's not as organized as we are, a law firm. But this is one tool we use to help best represent our clients, and we're going to be doing a lot more of these videos. But I hope this little tour was useful to you, and um, thank you, Jay, for the shared screen tour of the meds tab and how we keep track of medical records, bills, and our clients' treatment.
Absolutely.